Hello, I'm Paul Fenewalt, Missouri School Boards Association Special Advisor to the Missouri Center for Education Safety. I'm here today with the Green Clean Institute, David Thompson, to bring you number 3 in the series on environmental health and education. You will see on your screen there the website for the Green Clean Institute and where you can go to look at the previous webinars in this series and to find out more about the webinar series that we're presenting here. The webinar today, we're going to talk to you about infection prevention, a very important aspect of cleaning green. The challenges we face. Outbreaks or epidemics of disease are a business concern, and it should not be an excuse for implementing green practices in the workplace. H1N1, MRSA, and bird flu have sent shockwaves through the world because no one wants to see a pandemic or communicable disease devastating communities. Therefore, businesses, schools, and other areas of public interaction are resorting to drastic means to clean facilities that have been compromised due to human infection.
Thank you, Paul. That was a quote by Daryl Hicks, the author of Infection Prevention for Dummies. And back in 2007, I coined a phrase, just to say that a building is clean does not mean it is healthy. But if a building is healthy, it is clean. And nothing stresses this point any more directly than infection prevention. As you said, today's discussion is on infection prevention. And as we've talked to you in our previous webinars, the 3 parts of our series is all going to focus around information, education, and communication. So today, most of our program is going to be about education. What is it that we are talking about when we're talking about infection prevention? There are many details. We'll not cover all of them in our short 30 minutes with you today, but let us get started on those. The first thing we'd like for you to know is that what you do has direct and immediate impacts. The impacts of what we do is varied depending on what we're doing. What many are doing now is still a question. But I would like to say that what most people are doing is they are using whatever strongest atom bomb type product that they can to kill everything in sight. Well, let me point out to you that you don't need to go and get the strongest chemical in the shelf. You don't need to go out and expose yourself to hazards that are unrealistic. Not in today's world, and these issues have direct impacts to our health. You've seen people walking around with rubber gloves, and I'm not saying that you should protect yourself, but let's not need to have to do this because of the chemicals that we're using. We do not want you to be a part of this group that's using the atomic bomb type of approach.
That's kind of the maybe the easy way, but not the best way, Dave.
Well, this is true. From a greener point of view, we'd like to point out to you that what you actually need to do is use a more targeted approach, such as a hammer on a nail. You don't need a big mallet to drive in a little bitty nail. So know what you're after, know what's going on. What we would like for you to do is focus more on physical removal and less on the pH of the product that you're using. This reduces your exposures as a frontline worker. There are standard operating procedures, and these operating procedures need to prevent illness. This is what this is largely about. And it's preventing the microbes from getting a foothold. This is removing the food and the moisture, and these are the 2 essentials for a living microorganism to survive. So, what is it that we can't see? You can always see this dirt, and it's the visible soil. We can wipe this away. It's not much of a problem. We don't need much more than water to do this in most cases. And when you remove that soil, the question is, does your disinfectant really work if it's loaded up with all that soil? You need to really look at this because there's a lot of cleaning going on out there that's removing the visible soil, and the disinfectant simply can't do its job. Now, to that, we want to know who makes the difference. Who are the people that are removing all of these microbes and all of these little bugs and all the dust and the dirt and everything? Who's responsible for this? We'll focus on that a little bit later in our next webinar, but for today I would like to ask you if you know what the 2 basic principles in all cleaning is. Well, I'll tell you because you probably don't know where I'm going, and this is pH and physical removal. Whenever you use less pH and more physical removal, it's going to be healthier for your environment.
Mike Trangle, VP of External Affairs at the Asthma and Allergy Foundation of America, had the following to say about this. Each year, influenza is a primary trigger causing asthma attacks in the fall and winter months, and the leading cause of ER visits for asthma. Adults and children with influenza are encouraged to get a flu shot each year to reduce their risk.
Well, to the point of what Mike is saying there, is influenza has dramatic health impacts on our society. Just let me give you a few of the details here, survival times, which you may not know. And we covered this in the last one, but I think it's important to cover this again today. 8 to 12 hours on paper or cloth, 24 to 48 hours on a non-porous hard surface, and up to 72 hours on a wet surface. And most school facilities, most home facilities, it doesn't matter where, we all have these surfaces. So if it's the leading cause, this is where it's coming from. To that point, this is a contagious respiratory illness. From 5 to 20% of our society get the flu every year, and over 200,000 are hospitalized. And this is why Mike said what he did. Now, I don't know about you, but I'm not really the one that wants to be set up with the flu at home. And this is what's coming on in our schools, is because not enough of us are staying home. We're bringing it to the school. Now, we also need you to know that there are certain terms. When we start talking about influenza virus, there's also these terms that we need to know about. Well, there's two of them that we know, and it's germs and bacteria. This is the catchphrases that we use. Now, germs is not a scientific term. It's better really understood as bacteria, virus, or fungus. And these are the living organisms that we're really after. So let's explore these a little bit more. So the first thing we're going to talk about, Paul, here is the types of viruses. Now, the types of viruses, you've heard of these,
Sure.
HIV virus,
Yep.
okay. We also have talked about the HBV virus,
Yes.
all right. We've also talked about norovirus.
Okay.
All of these are viruses that are smaller than a bacteria. And by the way, you can't see a bacteria. So these are smaller than something you can't see. These have to have a living organism in order to grow and reproduce. Why is this important? Because an antibiotic, a disinfectant, cannot kill these viruses. So if it's influenza virus that is causing the illness, you cannot kill this with a disinfectant. All right?
Okay.
So when we talk about this further, we've got bacteria. That's the other side of what we've been talking about in infection prevention. Strep throat bacteria, I can take a pill for. I mean, you've seen people do that.
Sure,
We've
sure.
done that. Okay. Another thing we've done is if we get an ear infection, we have drops for that ear infection.
Sure.
This is an antibiotic that kills the infection in the ear. All right.
Okay.
These are antibiotics. They can kill most bacteria. But what you also need to know is bacteria can live on their own. They do not have to have a host in order for them to live. Let's further that a little bit. Bacteria can adapt to their surroundings. They can adapt to you or whatever's there. They can survive. They can even multiply. And as of late, with the big superbugs, they have developed a resistance to the antibiotics that we use to kill them. Now, why is this important? Because these two things are not the same. But what is the same between the two of them is if we use less pH and more physical removal, I can still remove both of these because they still can be wiped away if I do it.
Okay.
All right? So, there are disinfectant options that we need to explore, and I think we have some comments from some of our panel.
Okay, many of you may know Eddie Hedrick, who's with the Department of Health and Senior Services. He's their Emerging Infections Coordinator, and he has the following to say. Your products must be EPA approved for environmental application.
Now, what does that mean? If you're going to use bleach, it has to be approved by the EPA. Most bleach is not. Therefore, if you look at the qualifications of a disinfectant, most bleaches are not EPA approved as a disinfectant, and they are definitely not approved as a green product. So we're trying to say that just because it has an EPA registration does not mean it is safe. There's some bleach that has an EPA registration. That doesn't mean bleach is safe.
So you really need to know kind of what you're dealing with.
Absolutely. So then you talk about hydrogen peroxide. Well, hydrogen peroxide is generally regarded as safe, or GRAS as we kind of say in the industry. There is also accelerated hydrogen peroxide products, but this is hydrogen peroxide that also has phosphoric acid along with it to help it do its thing. These are both better choices than bleach, and in some cases, not all, they have an EPA registration as well. So like you said, you've got to be careful of what you're doing with here. Not all hydrogen peroxide, not all bleach are registered. Now, to the points that we're talking about here, mainly these are cleaners. Disinfectants, they destroy, they kill the inactive, the undesirable organisms, but they don't really kill their spores. This is a whole nother area. And I don't want to get too scientific today. This is not the purpose here. But what I do want to impress upon you as a viewer is that there are many levels to this. There's many issues that you need to think about before just getting the best known quat that you can. Let me point out something. A quaternary disinfectant is that. However, also know that fibers, which is cotton and such things that are mostly in our cleaning rags and our mops these days, they may actually neutralize or absorb the active ingredients in the quats. Therefore, this kind of renders them diluted. So what we'd like for you to do is, if you're using quats and you're still using cotton cloths and rags, that you need to actually test this product before, because you may actually be using a disinfectant and the cloth that you're using is rendering it ineffective.
So again, it's kind of important to know what you're doing.
Absolutely.
Diane Stewart, GCIC consultant at EnviroRocks LLC, has this to say about biofilms. Biofilms in residue are key factors. If the product being used is leaving behind sticky residues, which most do, then there is a potential for creating a perpetual biofilm cycle where the same thing you're using to kill the bug is creating a safe haven for them to reproduce. A clean surface where there is no residue is a germ-free surface. Ensuring an HMIS rating no higher than 1 on a green sanitizer or disinfectant is the best guide to health and safety available in this category of chemical.
Well, what Diane is talking about here is, as I just said, if I'm using the bleach or the hydrogen peroxide or the quat and I'm not doing the job properly, now what I'm doing is I'm leaving this biofilm, this thin, invisible, resistant layer of microbes, because we didn't remove them all. We didn't kill them all. And so they're laying down a coating on all these various surfaces. Now, this bacteria is what we're going to come in contact with. So what we basically have developed here is a sticky biofilm for more bacteria to stick to infect us with.
Eddie Hedrick, again from the Department of Health, has this to say on cleaning and biofilms. Cleaning and or disinfecting lowers the bioburden of biofilms to a safer level. What exactly does that mean, Dave?
Well, what that means is when you touch these surfaces, let's say, for example, this bathroom, if I've left a biofilm on there, it's impossible for me to remove completely that biofilm. And if I do, the next person that walks in is going to touch it and leave some more. What Eddie's trying to say is, as we go through and we touch these surfaces, we need to know which ones we're cleaning and do as much as we can to lower that biofilm. With whatever process, whatever product that we're using, this is what green cleaning is all about. The CDC recognizes that there are certain infection prevention points, and if you study a lot about this, you'll notice that they mainly are talking about this with MRSA. And MRSA has become that bacteria that's become resistant. Yeah. And so we need to really pinpoint what we're doing, back to using the hammer and the nail approach. These are the areas that you're going to go for and try to get that surface as clean as possible, reduce that biofilm, and you need to do it as often as possible. In some cases, once a day is not enough for these. Now, there are certain terms that you need to understand in the cleaning industry. And the first one is a fomite. And you see that here, there's no sign that warns that this is a fomite. But yet these little guys, these little bacteria and these viruses that we talked about, love to hang around on these places. This is that inanimate hard object that carries the bacteria back and forth. Doesn't move anywhere, but every time you touch it, you're the one. So this is what a fomite is. On the other hand, vectors are these blood-sucking little organisms that we all live with, and they're always around, and these are the ones that are moving it around. So you have the living organisms that carry the viruses.
So they're the carriers.
Right. This is what we're trying to deal with. No, you're not going to go around and kill mosquitoes with a cloth, but you need to know what these different terms are whenever you're cleaning. Because what you're in charge of as a frontline worker is prevention of these two issues on the high-touch surfaces. As you notice, this gentleman here is cleaning the inside switch lever of a toilet stall. Just as important as the door handle to the outside of a building, or maybe even the water fountain. It's all about pH and physical removal.
It's kind of like in layman's terms that I can understand. You need to use some product, but you also need to use a little bit of elbow grease.
Now, well, you know what? I grew up with that, and it still is good today because the bacteria and the virus hasn't built up a resistance to me and my elbow grease.
Yeah.
Okay, so coming to that point, what we encourage you to do is spray and rotate. And what this means is you spray as many surfaces in that classroom, in that meeting room, in that office building as you can. And then you rotate around the building and you come back and you use the appropriate microfiber, a squeegee, whatever it is, because here it is, a balance of pH and physical removal. So let's move on just a little bit to how do we know what we're doing? I mean, you can't see microbes, you can't see virus. We said a virus is smaller than a bacteria. So how can I see them? Well, there's certain metrics in our business that we use these days. And you see the ATP meter that was in the hand there. This tests for adenosine triphosphate. And I never can say the word right, but you get the idea. This is the universal energy molecule in all plant, animal, and bacteria, yeast, and mold cells. So this is what the living organisms are. Whenever we use this meter and we test, this is science. This is proving what I cannot see with my naked eye. I want between 0 and 10, and I will consider that surface clean. If my reading comes out from 11 to 29, well, it's kind of adequate, but it's not really as good as I want. And if it's over 30, I need to give it some attention. So whenever I'm trying to clean these areas, now I have a way to actually develop a scientific way to look at that. Now, there are certain green factors when it comes to infections. And what I'd like to impress upon you as a person that's working in a school district is that you are on the leading edge of a healthy society. You are the ones that are protecting the health of the people that are in that building. The medical community, on the other hand, is on the trailing end. We have to have both. We cannot clean our way to health, and we cannot take care of our way to health by the health community. We have to have both on both ends of our health cycle.
Following is a quote from Marjorie Cole, school nurse coordinator for the Missouri Department of Health, who was previously a school health nurse for many years in the St. Louis area. Prevention and control of communicable diseases. A guide for school administrators, nurses, teachers, child care providers, parents, and guardians. It's a document that Marjorie recommends. Cleaning and sanitizing and disinfecting. She talks there in this section about general information about cleaning, sanitizing, disinfecting, guidelines for specific items commonly used in the child care and school setting, and a checklist for choosing a disinfectant other than bleach.
Now, if I might, just point out what Margie was pointing us to here, is that it says that there's this checklist, and this is what the Department of Health and Senior Services puts out, but it also gives us a checklist for choosing something other than bleach. Doesn't say that bleach is the only thing, doesn't say we have to use it. There are different alternatives, and that's what our whole program wants to do, is tell you that there are different alternatives, not one, not another, but be informed and then use the guidelines that she pointed us to.
Okay, and I assume those guidelines are readily available through the Department of Health, or maybe they could contact the Green Clean Institute to get a copy of that?
Let me go back here for just a moment. And if you look on their website at the Department of Health and Senior Services, you will find this listed right in their list of things. It's a massive document. I mean, it covers everything and gets down to details that we're not going to cover today.
So that's, again, probably a good document. Maybe our people watching this wherever they want to download and at their convenience refer back to it from time to time as a reference document.
Absolutely, Paul. I mean, it's there and it's made by our state for a reason, and it works very well with the school law that was put in place back in 2009. What we're trying to talk about here with infection prevention is, Kermit says it's not easy being green. And if you're a disinfectant or if you're working in infection prevention, it's even tougher to be green. And we're not trying to say don't use bleach, and I won't want to hit on that too much, but it still is the issue. We think that we need certain things that kill everything, and we really don't. It's choose wisely what we're going to use. Manage what we cannot kill. We cannot kill every bacteria. And by the way, we don't want to kill every bacteria. We need them to live. And so what we're trying to say here is target what you're after. Don't try to destroy everything. Just mitigate what those circumstances are.
Something else Daryl Hicks here points out, simple cleaning of the environmental surfaces may be one of the key defenses in the future battle against infectious disease. With antibiotic-resistant organisms proliferating on common touch points for up to 56 days or longer. Wow, that's a long time. The study of cleaning and measuring cleanliness is becoming all important. The time has come to turn cleaning professionals into hygienic specialists. Moreover, infection prevention will only become a reality when the hygiene specialist is properly regarded, educated, and equipped.
That's what this whole program is all about. What we've been trying to do is bring forth that there are documents, there are guidelines and specifications. Missouri put together the green cleaning guidelines and specifications for schools in 2009. We at the Institute have a 180 best practice standards. Here are two ways to benchmark what you're doing. As we just showed, with the Department of Health and Senior Services, there are programs there to support what we're doing. So what we're all about here is it's your choice. It's going to be your path that you decide. You're going to choose the speed that you're going to get there. Not everybody is at the same point. Not everybody is going at the same speed. Just get with the program. Watch our webinars. They're free at this point, and we hope that you can join us a little bit later for a certification class. I believe that's in October.
That's correct. If you'd back up a second there, Dave, to those two documents that you showed there, the 180 best practices and then the state benchmark standard. Again, the Missouri Green Cleaning Guidelines and Specifications for Schools, that can be obtained easily through an internet search, and then they can contact your organization again to learn more about the 180 best practice standards. Is that correct?
Absolutely, and if you'd like, we can even put a link to that, make it very easy. They can get both links right from our website if we'd like to.
That'd be great if we'd do that.
Paul, I'd like to kind of finish this part of it today by saying that if you go to the webinars and you watch all of your webinars, we've set up this program where they can get a certificate of completion of the webinar program and earn a discount for their certification come this October.
Yes, again, you see the website address there on the screen where you can go to find links to the webinars that we've completed, as well as further information about the program we're going to put together as part of our Safe Schools and Colleges Conference this October. It's actually October 3rd, I believe, is when we're going to have that.
I'd like to thank those contributors to our program today. They are partners in this very important message. And if you're watching this and you're not from Missouri, we're not going to hold that against you. Anybody can watch this. Anybody can take the program and employ it and implement it in your school, in your state. This is for any state, parochial or private school, and even some higher education might even be able to use some of this.
You're absolutely correct. I want to say a special thank you to David, to you, for your bringing this valuable information, partnering with the Missouri School Boards Association and the Center for Education Safety to bring it to the people that are out there in the forefront, in the trenches against this this fight to ensure that our children in our schools and educational institutions are safe and have an environmentally friendly and safe environment in which to work.
I think what we'd like to do is we're trying to bring a public awareness to the fact that custodians, janitors of any private or parochial facility are very responsible people. They have a very important task ahead of them. And as the environmental health services engineers of our society today, we have a very heavy responsibility to take care of the buildings in a very programmed and responsible way. And once the people can understand this information, we hope that more people will join the ranks.
We at the Missouri School Boards Association and the Center for Education Safety want to say a special thank you to you, the viewers of this webinar series, for the good job that you're doing and for your willingness to learn more about this important topic. Again, I want you to make for sure that you're aware of the webinar series. Our next webinar is this next month. It's always going to be on the third Wednesday at 9:30 a.m. And then also, again, consider taking part in the certification process that's going to take part on October 3rd as part of our Safe Schools and Colleges Conference. You can actually leverage participation in this webinar series to attend that training and receive a certification at a reduced cost.
Our next webinar, as you said, will be next month, and it will be on who's responsible. Who is actually responsible for bringing this knowledge, this education to the forefront and actually impacting environmental health?
All right, very good. Thank you again.